Today, I want to speak directly to you, especially if you are over 60 and living with diabetes or pre-diabetes. This message isn't sponsored by a food company, and it probably won't make me any friends in the processed food industry, but it might change your life. You see, there's a common belief out there that whole wheat bread is a healthy, safe choice for diabetics. It's marketed as heart-healthy, rich in fiber, and better than white bread. But the truth is, for many of my patients, and possibly for you, whole wheat bread could be silently undermining your health. So let's be honest. Why does everyone believe whole wheat is good for you? The answer is rooted in decades of dietary guidelines that focused on reducing fat and increasing fiber. Whole grains were framed as the answer, white bread became the villain, and whole wheat its virtuous twin. But that's not how it plays out in real life. Most whole wheat breads you see on store shelves are highly processed. The wheat is ground so finely that the body digests it almost as quickly as table sugar. That means when you eat a slice of whole wheat toast, your blood sugar can spike almost as fast as it would if you drank a sugary soda. This may sound surprising, but if we look at the glycemic index, a scientific measurement of how quickly food raises your blood glucose, white bread scores about a 73. Whole wheat bread, around 71. Not much better. In some cases, especially with commercial brands, it's even higher. Now imagine you over 60. Maybe your insulin response isn't what it used to be. Maybe you're already taking medications for blood sugar control. You eat your healthy whole wheat toast in the morning, and an hour later your glucose is through the roof. Your pancreas rushes to pump out insulin, and over time, this constant battle wears down your system. The result? Worsening insulin resistance, fatigue, inflammation, and increased risk for complications like nerve damage or cardiovascular issues. It's not just about carbs, it's about how your body handles those carbs and how quickly it's forced to respond. And unfortunately, the food industry has been playing a dangerous game with your trust. You think you're doing the right thing. You read whole grain on the label, but the truth is, there's no strict regulation for how much whole grain a bread must contain to be labeled whole wheat. Most commercial breads contain refined flour, additives, sugar, and coloring agents like molasses to make it look darker and healthier than it actually is. It's a marketing trick, not a medical fact. Let's go deeper. What actually happens when you eat this type of bread? The finely milled grains are absorbed quickly, leading to a blood sugar spike. That spike is followed by a crash, leaving you hungry again shortly after. You reach for more carbs, repeating the cycle. Over weeks, months, years. This pattern contributes to weight gain, energy dips, mood swings, and yes, worsening diabetes. And the scary part is that many seniors are doing this daily. Toast in the morning, a sandwich for lunch, maybe even whole wheat crackers as a snack. All with the best intentions, and all while their blood sugar quietly spirals out of control. Now, you might be asking, is there research to back this up? Yes, and quite a bit. One study published in the American Journal of Clinical Nutrition found that whole wheat bread raised post-meal glucose levels nearly as much as white bread, offering little benefit for insulin regulation. Another from the University of Toronto tested various breads and concluded that the majority, even so-called whole grain versions, triggered significant glucose and insulin spikes. Interestingly, people saw far better results when they consumed slow-fermented sourdough breads or breads made from sprouted grains. Why? Because these options digest more slowly, produce a lower glycemic response, and are less stressful to your metabolism. So, what should you eat instead? I'm not saying you have to give up bread entirely, but it's time to be selective and strategic. One option is sprouted grain breads, such as those made by the Ezekiel brand. These breads use sprouted whole grains and legumes, which are digested more slowly and don't spike your blood sugar as dramatically. Another excellent choice is low-carb breads made from almond flour or coconut flour. These are naturally high in fiber and healthy fats, and they barely impact glucose levels. Real sourdough bread, and I emphasize real, not the supermarket sourdoughs made with vinegar, may also be a good option, especially if it's fermented slowly using traditional methods. This process changes the structure of the bread, lowering the glycemic index and making it easier for your body to process. Some of my patients have had great success with homemade keto breads, which use flaxseed, eggs, and psyllium husk to create a bread-like texture without the carbs. If you're open to it, you can also ditch bread altogether and opt for lettuce wraps or collard greens, nature's low-carb wrappers that won't affect your blood sugar one bit. If you're watching this and feeling overwhelmed, don't panic. The goal isn't to make you afraid of food, it's to empower you with better information. If you've been eating whole wheat bread daily, you don't have to throw everything out today. But I would suggest taking a hard look at your pantry. Read the labels. If the first ingredient isn't 100% whole grain, or if you see enriched wheat flour, sugar, or caramel coloring, you're not eating what you think you are. Next, do a little experiment. If you have a glucose monitor, try this. Eat your usual slice of whole wheat toast, then check your blood sugar 1 hour later. Then do the same with a slice of sprouted grain or low-carb bread. See the difference for yourself. Your body doesn't lie. You should also talk to your doctor or dietitian. And I say that knowing that not every healthcare provider stays current with nutritional science. But the conversation is worth having. Bring them the studies. Bring them the numbers. Your health is too important to leave in the hands of old assumptions. And finally, share this information. Maybe you're not diabetic, but your spouse is. Maybe your friend at church is struggling with sugar levels and thinks she's doing everything right. One small change, one better decision, can make a big difference over time. Let me end with this. I've seen hundreds of patients over the years who were trying their best, eating what they believed was healthy, and still watching their blood sugar climb. Many were shocked to discover that whole wheat bread, their so-called safe food, was part of the problem. Once they made the switch, they started seeing real progress. Less fatigue, fewer glucose spikes. Some were even able to reduce their medications under supervision. And that's what I want for you. Not perfection, but progress. You deserve better than misleading labels and outdated advice. You deserve clear, honest, science-backed guidance that helps you feel better and live longer. If this video resonated with you, please consider subscribing to the channel. Leave a comment if you've experienced something similar. And most importantly, share this with someone you love. Because for far too long, the truth about bread and blood sugar has been ignored. And it is time we start telling it.